Hi, my name is Andrea Gispi. My topic is efficacy and long-term safety of a dengue vaccine in regions of endemic disease. Definition: Dengue, a debilitating viral disease of the tropics transmitted by mosquitoes and causing sudden fever and acute pains in the joints.
Dengue, also known as dengue fever, an acute mosquito-borne viral illness of sudden onset that usually follows a benign course with headache, fever, prostration, severe joint and muscle pain, swollen glands, lymphadenopathy, and rash. The presence, the dengue triad, of fever, rash, and headache, and other pains, is particularly characteristic of dengue. Dengue is endemic throughout the tropics and subtropics. It goes by other names including breakbone or dandy fever. Victims of dengue often have contortions due to the intense joint and muscle pain. Hence, the name breakbone fever. Slaves in the West Indies who contracted dengue were said to have dandy fever because of their postures and gait.
Dengue vaccine. Dengue vaccine is a vaccine to prevent dengue fever in humans. The World Health Organization only recommends the vaccine as a possible option in areas of the world where disease is common. In 2017, the manufacturer recommended that the vaccine only be used in people who have previously had a dengue infection, as outcomes may be worsened in those who have not been previously infected.
The vaccine contains 4 strains against the 4 types of the dengue virus. Once in the body, the vaccine activates the immune system and the production of antibodies. The immune system is activated in 3 steps. The dendritic cells capture and carry the vaccine strains through the lymph vessels to the lymph nodes. They activate T cells, which then activate B cells. The B cells multiply and begin producing antibodies. Antibodies against the 4 types of dengue virus are disseminated throughout the body via the bloodstream. When an infected mosquito bites someone who has already been vaccinated, the virus that enters the body is immediately recognized by the immune system. Specific antibodies that were generated by the vaccine neutralize the virus. The dengue virus is stopped by the person's own immune system.
Applications in medicine. Vaccines are considered as one of the major contributions of the 20th century and one of the most cost-effective public health interventions. In the situation of growing and potentially fatal infectious disease without effective prevention and specific treatment, the value of protect vaccine is clear. There is no licensed vaccine is available still, but some vaccines are under development, include live attenuated virus vaccines like chimeric virus vaccine, inactivated virus vaccine, live recombinant DNA, and subunit vaccines.
French pharmaceutical giant Sanofi Pasteur on Friday announced the publication in the medical journal The Lancet detailed results of its first landmark Phase 3 Dengue vaccine efficacy study that could pave the way to combating the mosquito-borne virus that sickens millions every year. The late-stage trial involved 10,275 healthy children aged 2 to 14 across 5 countries in Asia, a region that accounts for over two-thirds of the mosquito-borne disease's global burden. Sanofi had already disclosed in April that its vaccine reduced the incidence of dengue fever by 56% in the Asian study, without giving details. The full findings were published online on Friday in The Lancet. Speaking ahead of the study's publication, Sanofi Pasteur's head of research and development, Dr. Nicholas Jackson, described dengue epidemics as a frightening event.
If you've ever seen an epidemic of dengue in a hospital, the wards are overflowing. People are literally lying in the corridors. And in some countries, patients are triaged in tents before they're admitted into hospitals. So an epidemic where as many as 1 in 20 people can be affected is a frightening event.
Nearly half the world's population is at risk of contracting dengue fever, also known as breakbone fever, because of the severe pain it can cause. The disease infects some 100 million people each year, according to the World Health Organization, and some experts put the number at triple that level. Most patients survive dengue, but it kills an estimated 20,000 people each year, many of them children, and causes 1 hospitalization every minute around the globe. The study found that the vaccine reduced the most serious cases of hemorrhagic fever by nearly 90%, which Jackson hailed as a breakthrough in the fight against the disease.
So our vaccine will have a significant public health value, given that we've shown, in addition to reducing just over half of all disease, we've also shown that we can reduce disease by 88% in the severe form. And this is critically important when you think about the gravity of a severe infection. You can be a child at risk of hospitalization, you can suffer from internal bleeding, organ failure. It's a life-threatening disease. And our results also show that we can reduce hospitalization by 2/3.
But the vaccine offered poor protection to young children, who are most at risk from dengue, and proved notably inefficient in tackling one of the viral disease's 4 strains. The results suggest the new vaccine acts best as an immune booster for patients with some previous exposure, and therefore may be useful in tropical regions where dengue is common, rather than as a vaccination for travellers. Since there is no vaccine now, that could still make it an important weapon in the fight against dengue.
Pros and cons. It turns out that where dengue has high transmission rate, the vaccine is 20 to 30% effective. That's the good news. Although in vaccine trials and hopes for a 30% effective rate. The bad news is if it is in a low transmission rate area. The vaccine may increase illness and hospitalizations. Research believes that if a patient receives that vaccine after first being infected by dengue, the patient is then protected from that second harsher infection. However, if the vaccinated patient has not first been infected by dengue and is then exposed to the virus through the vaccination, the patient's reaction is much like the harsher second infection experienced by those not vaccinated when they are naturally exposed to the virus.
Dengue is a threat for nearly half of the world's population. Every year, Latin America is affected by epidemics. Dengue virus, transmitted by a mosquito, can provoke a hemorrhagic fever, especially in infants. 10-year-old Melissa, now cured of dengue, returns to the hospital for a checkup.
When I had dengue, I felt very sick because my eyes and my bones hurt, and I had a very high temperature. And when I went to the doctor and they didn't know what was wrong with me, I got worried. Then they sent me here, to the hospital. When they diagnosed dengue, I got very worried. I felt overwhelmed because I had heard there are several types of dengue fever. And I had also heard of people who had died as a result of dengue, and I was extremely concerned. At present, there is no specific treatment for dengue, nor is there anything to prevent it. Only symptoms can be treated to reduce the patient's fever, pain, and general discomfort using paracetamol. A dengue vaccine would be a significant advance because of the high incidence of dengue in the area.
Apart from fighting against mosquitoes, for the moment there is no means to efficiently protect the population against this illness.
Dengue is a major public health issue in Mexico, and a dengue vaccine is key. It's crucial for the fight against this disease.
In this hospital on the outskirts of Mexico City, 15-year-old Jessica is taking part in the clinical trial of a vaccine developed by Sanofi Pasteur.
We are carrying out a study for a dengue vaccine with 600 volunteers, children between 9 and 16 years of age. We want to see if the vaccine elevates the level of antibodies against the 4 dengue virus serotypes. That's our first objective. The second objective is to follow the participants over 1.5 years to verify the safety of the vaccine.
I think it's a good thing to be a part of this, because what we're doing could help to prevent other people from getting dengue in the future.
Sanofi Pasteur conducts clinical trials like this one in a dozen countries in Latin America and Asia. As a result of these trials, a dengue vaccine could be available in a few years.
Issue applied in Ecuador. Dengue fever is a serious and sometimes fatal illness of the Americas, Asia, and Africa. Symptoms include fever, headache, muscles, and joint pain, swollen glands, pain behind the eyes, and rash. Dengue can develop into severe dengue, so it's important to seek medical help if you have these symptoms. Severe dengue can be fatal, but if detected early, diagnosis is usually good. There isn't any medication or vaccination against dengue, so try to protect yourself against the mosquitoes in the areas dengue exists. Dengue is an increased problem in the public health in Ecuador. 11,322 cases of dengue were registered in Ecuador between the weeks 1 and 38 years in 2013, from which 60 cases were severe dengue.
Did you know that a single Aedes mosquito can lay up to 300 eggs in its 2 to 3 week lifespan? It can take less than a week for a mosquito to grow from larva to adult. And each female mosquito has the potential to spread dengue to you and your loved ones. Contrary to popular belief, the Aedes mosquito is not born with the virus. It feeds on blood so that it can produce eggs. And when it feeds on the blood of an infected person, the Aedes mosquito will carry the dengue virus and pass it on to a healthy person when she feeds again. Dengue can cause high fever, intense headaches, muscle pains, joint pains, nausea and vomiting, and skin rashes. The disease can be very painful. A few cases can develop into life threatening dengue hemorrhagic fever, resulting in bleeding, low levels of blood platelets, and blood plasma leakage. It can also result in dengue shock syndrome, where blood pressure can drop to dangerously low levels. Severe cases, if left untreated, could result in death. Our homes and neighborhoods are places of joy and togetherness, and dengue is not something any of us want in our lives. While there is no vaccine against dengue, we have the power to stop dengue together. All we need to do is look for and clear away any stagnant water where mosquitoes can breed. By doing so, we can protect ourselves and our friends, family, and community. By fighting dengue as one, we can stop its dangers at once.
It's my fight too.
It's an age-old fight, and I'm still in it.
We are small, but we fight big! Yay!
Our lives, our fight.
Conclusion. Although due unexplained hidden inside of hospitalization for dengue in year third among children younger than 9 years of age needs to be carefully monitored during long-term follow-up. The risks among children 2 to 16 years as of age was lower in the vaccine group than in the control group.